Now this is a little orientation mark that he's about to put on there. It's a little ink stamp. He puts it right over the pupil. The pupil is not always in the middle of the eye, believe it or not. It can be a little eccentric. It can be a little off-center. So Dr. Lipsky gets the light real bright, as small as the pupil will go, and he marks right on top. Dr. Lipsky wants the flap perfectly centered over the pupil. Dr. Lipsky, you'll learn quickly, is a perfectionist with a capital P.
Is it hurting him right
No,
now?
he's completely numb. He's been numbed with 3 different drops: proparacaine, tetracaine, and lidocaine. You could do surgery on an elephant on this point. Now this is the suction ring.
Oh yeah, that's right.
Amanda, who's assisting him right now, she has the end of a syringe plunged in with a spring on it, and that's a little rubber gasket on the bottom. He's placing it on the cornea, and when he gets it right where he wants it, he'll tell Amanda or whoever's assisting, suction on. You'll maybe be able to tell that his pupil dilates a little bit once we get proper suction. His eyes are awfully dark, so you might not be able to see it. He's getting it right where he wants it. See it dilated a little bit? Now we're putting him under the interlace. That you're looking through right now is a glass bottom cone. We call it a PI. That glass bottom cone is going to come down and dock inside that suction device and apply a gentle pressure onto the front of his eye. You'll see it as it comes closer into focus. We're getting close. Now that's the glass actually pushing the meniscus, the tear film, completely out of Dr. Lipsky's way. The interlace laser will not fire through any kind of aqueous at all, so we have to make sure that everything is squished out to the side. Dr. Lipsky's looking at it, and he's telling Amanda how he wants things adjusted. Up, down, left, right, make it smaller, make it bigger, change the hinge, whatever he wants. Now that's the actual flap being made. 50 million micro explosions are happening at this point as it passes through the cornea. It's going right through the epithelium, right under the epithelium, and it's separating the tissue as we go. This takes about 32 seconds. If Dr. Lipsky at this point should decide to abort the procedure for any reason, 30 minutes later you would never be able to tell that we did anything to this eye. The flap does not exist until Dr. Lipsky actually physically lifts it. And that's it. That's how long it takes us to create the flap. Now we're going to repeat the whole process on the left eye.